and welcome to the Monday Evening Speaker Series. My name's Ty Cliffel. I'm the Director of Programs at Adoption Network Cleveland. Tonight, we're excited to welcome Ashley Mitchell and Kelsey Vander Vliet Ranyard to discuss advocating for change in Utah's adoption landscape. Ashley is the director of the Knee to Knee Post-Placement Program, which seeks increased care, understanding, and resources for birth mothers. She's an advocate for adoption reform, women's health, grief and trauma, and reproductive trafficking. And she's the creator behind Big Tough Girl on Instagram and the co-host of the Twisted Sisterhood podcast with Kelsey. Kelsey is the director of public policy and advocacy at Ethical Family Building, where she leads state and federal efforts to enhance protections for all parties in private adoption and center children's long-term well-being. She's the co-author of the 2023 book Adoption Unfiltered, the co-founder of Utah Adoption Rights, and the co-producer of the documentary Carrying, which is coming out in 2026. She also serves on the advisory council for the Congressional Coalition on Adoption Institute, lending her lived and professional experience to national conversations on adoption and child welfare policy. We're really grateful to have you with us tonight. Thanks for being here.
Thank you. Well, okay, that's our intro, but now you know who we are. So we just want to go through, this feels really informal because it's such a small group of people, and also we know Adoption Network Cleveland for several years. So we are going to go through the landscape of Utah adoption currently, the pathway of what the legislature is titling adoption tourism, and also explain to you why we are choosing to call it something else, and walk you through the legal safeguards that are weak, as we hold the opinion of, financial incentives for this adoption tourism, and our work with Utah Adoption Rights, as well as the rights that birth parents should know. And then we're hoping to have about 10 minutes at the end for Q&A. We are talkers, so we're going to try to get through this and have 10 minutes for Q&A. If we don't, our inbox is open. Mine specifically for the next 5 weeks because I'm going on maternity leave. But our inbox is open to talk. We're open to talk more and see how we can answer questions or work together, or et cetera, et cetera. So yeah, so Ashley, do you want to walk us through the purpose of Utah Adoption Rights and what we're doing here?
Yeah, so Kelsey's in California and I'm here in Utah. I'm born and raised in Utah, placed here in Utah. And my husband and I are raising our family here. Um, we spend a lot of time nationally doing a lot of work and reform with adoption professionals in our birth mom communities. And the disturbing stories that were continuing to come up that was happening in Utah just really kind of wrecked Kelsey and I. We've known each other for a long time and have worked together on different projects. And we just kind of came back together and just said, hey, look, it's in my backyard. And, she is the policy side and I'm the community connector. And so we just said, we got to do something. And so we decided to pick the toughest state in the nation to call out and work on reform. But our goal with Utah Adoption Rights is to ensure that if women are brought here to Utah from out of state and being presented with an option of adoption, that they understand what their rights are in this state. We are here to help them navigate the Utah code that they don't understand and help them empower them to use their own language to advocate for themselves if they want to change their mind, if they want to go home, all the things that are available to them that would not be shared with them. There's no transparency or honesty in the way that they're being treated and handled. And so our goal was to make sure that regardless of their decision, that they knew what their rights were before they stepped into it. And so it is the ultimate grassroots movement and work to try and get this information in the hands of the women. And it's been we've been 2 years boots on the ground here, and it's been a lot. It's been a lot, but we've worked really hard to try and help and inform, and we've had great opportunities with the press, which we'll get into. And but that's what we're doing, is making sure that the women that are being brought here understand how Utah systems operate so that they can advocate for themselves in the short time that they're here.
And I want to add too that like I think long term our goal was like we want to prevent this stuff from happening in all in all. When we first started, we were like we don't know what we're able to do. Utah has felt like such a big beast to us, and so we were like, let's start with um, we can reach them when they're there because we understood where they were being like taken. We understood where location wise they were. So we were like, if we can connect with them there, we can get them the information. And it's sort of expanded into more than that as with legislative work, but that's been the main goal because we're two people. So adoption tourism is what the Utah legislature is titling this. So it's basically adoption tourism. We don't love the term, but we also didn't come up with the term. So don't shoot the messenger. It's really families, both biological families, birth families, and adoptive families traveling to Utah for adoption for the purpose of conducting an adoption, giving birth in Utah and placing the child in Utah with a family who's not from Utah to get all the legal work done and using it as a ground for forum shopping infant placements. We have chosen for the past, I would say over a year, to, especially when we're talking to healthcare professionals and community organizations in Utah, to talk about this in the light of reproductive trafficking. When we've talked to nurses and social workers at the hospital, what they're telling us is that they were getting red flags for trafficking. Nurses are trained to spot human trafficking, and they were, and I'm going to share my screen actually, because I want to show you one of the resources on our website. But they were telling us that like this feels like what we've been taught about human trafficking. So, can you all see that very well? This is a resource for healthcare that's on our website, but it kind of can be transferable to, I mean, everybody can read, right? So um, these are kind of the red flags for trafficking and how we've transformed the human trafficking, sex trafficking, labor trafficking concerns, how we've transformed them to this specific issue, which we've titled reproductive trafficking. And so this is kind of was created based on our conversations with healthcare staff. And so this is how the isolation is a big theme. So when they're coming to Utah, pregnant, they're being super isolated in the process. So let's walk, and I want to walk through what exactly how this happens. So the first point of contact with these moms that agencies or the brokers that agencies work with, what they get is an advertisement. So these advertisements appear on Google typically, but also social media. So Facebook, Instagram, we've seen a lot, but mostly on Google because people are going to Google to look for help, just like you'd look for anything else. So here are screenshots of some of these ads. These are real ads. They're appearing all over the United States. 33 states say if you're not licensed at all in any state, you cannot work, you cannot advertise here. And then 22 states say if you're not licensed in this state, you cannot place advertisements in this state. And so these entities are in violation of those laws, as well as this bottom entity, which is a unlicensed intermediary broker out of Virginia who's in violation of basically 33 state laws on advertising, adoption advertising. And these are laws specific to adoption advertising. So not just like a random ad law, it's specific to the adoption code. Um, and what happens is, they're not being enforced. And so that's how, I mean, you can report and report and report. I know a lot of people in this session right now, attendees who we've had several conversations about reporting and the enforcement isn't happening. And that's one of our biggest hurdles a lot of times is the enforcement of the law can be really non-existent or really relaxed. So the second step that happens is these brokers and agencies are getting her to relocate to Utah for the birth and placement, which is an unusual practice, but it's really a well-oiled machine for 5 Utah agencies. So um, and some of the defenses that we hear a lot of times are like, well, what if they're in a domestic violence situation? And all well and good, like we want you to be safe during your pregnancy and have a healthy experience. However, what we're seeing when we're reading text messages and emails, these women are being asked to relocate before they're really getting any kind of case notes on what's personally going on. And we believe that's because that's in the best interest of the agencies conducting the placement for their financial incentives. So once they get to Utah, a lot of times they're not just being flown to Utah just themselves. A lot of times they also have other children that they're parenting. They're all being transported to Utah typically. They're put into a 1 or 2 bedroom apartment that is leased by the agency and then kind of a sublet to the mom, but doesn't have she's not really a proper tenant under Utah law because she's not really signing a lease to stay there. So there's a lot of gray area in terms of what the tenant law would be and her rights as a tenant, which is a huge concern when it's December and you're in Utah and you're changing your mind about adoption because you're out. So um, she's typically having her healthcare choices is in terms of who her healthcare provider is. That's typically a choice that's made for her. She may or may not be able to choose the family. We were hearing mixed stories. A lot of times these moms are not even able to choose the family, or they're given 2 choices and saying pick one. They're not meeting the family before they match. They're not getting to know them very well. And they're really isolated. They don't have a car. They're encouraged not to get a job. They have no support systems, and they're also not encouraged to speak to other women on the premises. Some of these agencies have like 16 to 20 apartments in a complex where moms are coming in and out all the time. But there's no kind of community building or support group systems they're not leaning on each other for anything. They're kind of kept apart. And then the counseling that they're receiving is not third party. It's someone that works for the agency. And then also, yeah, just a lack of access to healthcare. We've heard from healthcare providers that sometimes they're unclear on when they arrive to the state and they're coming to their office, coming to their clinic very late in pregnancy, 37, 38 weeks for their first prenatal appointment. They're very sick. There's a lot of concerns with healthcare and liability, and sometimes they're having to tell moms to go to labor and delivery on the spot. And also having moms travel sometimes late in pregnancy, which is against airline policy. And so the last point is delivering this baby, and 24 hours after delivery, she is typically expected to sign adoption consent paperwork and relinquish her rights. And after that point, going back to her apartment, getting her stuff together and making a plan to leave. We've spoken to women that have been asked to leave the apartments 24 hours after relinquishment, some who have been asked to leave 6 weeks after relinquishment. And what we have kind of determined is that it's a matter of when the next expectant mom is moving in. So whether or not they need that apartment right away. So that is the process. That is how it happens. These families are being placed with the baby and going through this very quick kind of rubber stamp ICPC process, going back to their home state, and they're finalizing virtually in Utah so that a judge in their state isn't looking at these cases. The judges in Utah are looking at these cases. And so if any violation of state law is like kind of flying under the radar a lot of times. The main incentive, which I think is the most important thing to recognize about the pathway to reproductive trafficking, adoption tourism, is that moms are offered cash after signing. So one of the most common things we've heard over the past 2 years is, well, they offered me $4,000, and it was $4,000 until this year it changed to $6,000. That's the most common thing. So they're saying, uproot your life. And I think a lot of people say, well, why would you do that? Why would you go to Utah if you have stable housing at home? Or maybe you don't have stable housing at home. Maybe that's why. But I think the final nail in the coffin on a lot of times on these travel plans is, let's get you the cash on the end of it. And so after you sign paperwork, we'll give you $6,000 and that's it. That is kind of what seals the deal. That's what we've heard from a lot of women. And these are women who are in just very extremely desperate situations. As you know, in many states, there is a lack of stable housing, lack of affordable housing, lack of job security. Childcare is a huge concern. And so these women really feel like they're backed into a corner, and I think they are backed into a corner. And so when this is the only option for them and you're dangling $6,000 in front of their head, it really constrains your decision-making process, and really just puts you in a pressurized environment. And so we talked to a lot of women who end up making choices that they didn't want to make, they felt they had to make, and ultimately we don't want that to be the reality here for women. So, Ashley, you want to take it?
When you look at that, and one of the most heartbreaking things is sitting with the women in the aftermath as they're starting to piece together like how things happen and what happened, and the reality of the consequence of these choices are hitting them. The unfortunate thing that they're learning is how calculated and intentional all of these steps are by the adoption professional that's bringing the women here. When you look at trafficking, there are 5 consistent grooming techniques that are always used. And so when you're thinking about the women, everyone is always like, well, who would come for $4,000 and who would do that? The amount of control and manipulation that these women go through without even fully understanding what's happening is so intentional. And so when you go through these grooming stages, Kelsey talked about the targeting. They are targeting very specific demographic of women. They're targeting low income, they're targeting marginalized communities that they know are already in crisis in some form or another. So the targeting is their number one first step, is to target who they want to take advantage of. Gaining trust and information, being there and answering their call the second they call or the second they text on the website. And then they're gathering the woman's personal information. And so they're going to do that as a trust building exercise while also using that information against them to abuse, threaten, and force relinquishment, whether that's threatening of CPS or the police if they have a previous record, anything like that, they're going to use against them. So while it comes across as they're building trust with these women, they're gathering information to use against the women if they turn against them at any time. The next stage is going to be filling a need. You need money and you're pregnant and need help and you need housing and you need this and you need this. They're going to fill that need. They're going to offer everything that they can. You just have to come to us and we can fill all those needs without informing them of the rights that they have within their own state, the support that they can get locally, whether the law benefits them better in the state that they're in. They're going to fill a need and they're going to oversell what they can offer to these women, even if they're legally not allowed to offer what they're offering. When we're getting into talking about money and you're getting into a felony sale of a child, we are walking dangerously close in Utah with the manipulation of money. The next Kelsey talked about is the isolation. The isolation is 100% exclusively for the final stage, which is control of the women. The women are brought here without transportation. A lot of times their phones are taken and they're issued other phones. They are placed in apartment complexes, and we'll get into the apartments in a little bit, but placed in apartment complexes that are completely isolated and away from public transportation. They're not within walking distance of locations to get out and be social. They're not encouraged to get a job. They're not encouraged to leave their apartment. Their caseworker comes and delivers their weekly allowance, their food, and picks them up and takes them to all of their appointments. So they are literally controlling every aspect. Every decision that they're making is being controlled by someone in the room. Now, one of the things that creates is a complete dependency on the professional. And so when the dependency is isolated to the professional, then the women have a sense of obligation to follow through and pay the professional what they have been told that they need to pay. And in this case, it's their child. They're paying with their child. The money, creating that financial dependency, creates this cycle of repeat pregnant women. When they don't understand the whole system of how this works, they don't understand that the adoptive parents are actually the ones paying the bills. When they don't understand these things, those things are kept from the women intentionally so that they believe that the agency is the one that's taking care of them. And so in crisis, if they find themselves in crisis a second time, they're going to go back to that agency every time. It does not matter what happened to them, how they felt like they were treated, what that process looked like. If they're pregnant again and they're in crisis again, because we're not actually fixing any of the issues that they had before, they're going to go back to the same place every time because it's a guarantee of money. And so those are kind of those grooming stages that the agencies are using, and it's very calculated. And the women don't know the lack of transparency from the time that the women get that first response in a text or a phone call to the time that they get here to Utah. Once they get here, they're already in it. And it's too late for them to do a whole lot. They have very little control over what's happening at that point.
Yes. I've been looking through the chat and trying to get answers for questions, but let me get back to our agenda. So I want to go over some of the gaps and loopholes in the Utah law that permit this kind of exploitation, and then also kind of combine that with the current legislation that's upcoming in the session. Utah started paying attention to this. The Utah legislature started paying attention to this in, I would say, last May and June. The interim judiciary committee started having hearings on this, and they got quite lively throughout the year in 2025. And the reason that they started paying attention to this was because hospital social workers and nurses approached them about it. And so I think people thought it was us, and it wasn't us. It was not us. It was people thinking that there was trafficking going on in their hospitals. And also hospitals issuing cease and desist letters to agencies saying you can't come here for adoptions anymore, and kind of a whole situation. So let's see. I'll start with actually things that are addressed in the bill, and then also kind of talk about things that aren't addressed in the bill that should have been, but one of the things, so the first thing is the nonprofit requirement. Currently, there's 3 for-profit agencies in the state of Utah. You can't see anything about their financial, anything about their financial status. So you have no idea. There's no 990 to pour through. You can't see how much they're spending on marketing. You can't see their revenue. The only reason that we know roughly how much money they're making is because we've seen a bankruptcy filing, a divorce decree, and their contract and their fee agreement. And so we have estimates, but we don't have sure things. And I'm not even licensing has that kind of information, which is a huge problem. It's not the only problem, certainly, but it is a huge problem when you are transferring children from one home to another, and we can't see your financials. There's no transparency. That's a huge concern of mine. The next thing is advertising. This is a provision that states that if you're advertising in states, in other states, that you should be licensed to provide adoption services in that state, and you cannot promise financial incentives in those advertisements. There's other things. They're trying to make a consortium for agencies to report data to the legislature. They want to require that all expectant moms have independent legal counsel, which we are supportive of. A lot of times these women they have no attorney giving them their rights. They actually have a caseworker that may or may not even be trained in social work, providing legal advice to them, which is a big no-no. But they have nobody's telling them what their rights are, and what their options are in the scope of those rights. So there are requirements for agencies to list out any of their current violations of licensing laws. There's some changes to living expenses laws, not as much as we would like. It still allows for a lot of financial incentive for women to place, but it does kind of cut off a limb in terms of they can't give lump sums of cash. That pretty much is cut off. There's a provision about not being able to give gifts, but that's kind of already there, so I don't know what that's about. There's a provision about not being able to transport women into Utah after 36 weeks, and the requirement to follow airline policy. There is a requirement to report for each agency to report how many women they're bringing into Utah every year for data purposes. Requirement to not just offer her counseling by someone that works for you, but like an actual mental health therapist. And then one of the most significant things I think here is adding a revocation period. Utah currently has no revocation period. So once you sign on the dotted line, that's it, it's final. And this adds a revocation period of 72 hours. It also puts a little bit more teeth in the bill at the end to point to licensing and make sure that licensing has express ability to suspend or revoke licenses. I think that's kind of been at discretion in years past, and sort of something you have to fight really hard for. But this points directly and says, yes, the Office of Licensing may suspend, they may revoke the license if they fail to comply with any of the requirements here. Which I do think that's important. Whenever we seek enforcement, a lot of times, the legislature doesn't always think about those things and put those things in. And then you have kind of lower level government employees that say, I don't know what I'm allowed to do here. And so this kind of makes that clear. Another thing that is in Utah law currently that kind of lends to the exploitation is there's a fraud immunity law. So this not only states that not only is this adoption final when you sign, but even in circumstances of fraudulent representations made, we're still not going to overturn this adoption. There's been many, many court cases about this. It's not been overturned through the courts. We're hoping that someday it will be. It's not in this bill. I do believe it does add other circumstances where it can be overturned, but it's not wild. It's not too imaginative.
Yeah.
I'll say that. We initially we wanted the bill to say you extend the consent waiting period. So between birth and signing consents, we wanted it to be extended beyond 24 hours. We requested 72 hours at first. And then after talking to stakeholders, we also sort of backpedaled on that as a priority for right now, just because we knew that once she was leaving the hospital, she was not going to a place where she had eyes on her situation. So she was going back to an agency apartment and
Yeah. Just Kelsey, just on that
yeah.
really quick. It's so hard because there's so many things that we would have wanted differently, but to really sit with stakeholders, like you have to understand Utah's so unique that way that the women aren't going back to their home, taking a shower, eating, having a night to think about it, get a full night's sleep. They're going back to an agency apartment where there's someone banging on their door, threatening eviction. And so it's safer, even if the time is still not ideal, for them to be in the hospital with social workers that have their best interests at heart than to send them home with the agency that's controlling them.
Yeah. So I think there was definitely some provisions that we recommended that did get walked back, but not for reasons of anything except it being specific to Utah. Utah is so special. And so Ashley, do you want to talk about just like the influence that the media coverage has had on this? Because it's been such a huge momentum for this.
The media has been just a fire hose, really, for everybody. When we started, it has been mind-blowing. Obviously, we've been working on this conversation with the arrest of Paul Peterson. I think 5 years ago, he was licensed in Utah, trafficking Marshallese women, Utah, Arizona, Arkansas, and has been a huge focus and started bringing a lot of awareness and attention. But when we started to focus back on Utah after Paul was arrested, the agencies were doing the same practices and following through with those things. And so when we decided to the only way that we knew how to get a hold of the women was to go door to door, we couldn't believe how much the press was like, we got to follow you around. We want to follow you around. We want to tell this story. So it was mind blowing. So when the New York Magazine, The Cut, did an article 2 years ago, it's been 2 years since the article came out, that really told a story about Jasmine. She's one of the birth moms that was brought here, evicted, threatened with the police were pounding on her door, evicted in December with a brand new baby she decided to parent. And the Cut article talked about her story and shared what happened to her. And after that story, we started delivering flyers. And the momentum of the press has, whether Utah wanted to address it or not, could not ignore their national reputation. And at the end of the day, they had to address it. There's things about legislation that have been really interesting, and we've been really grateful for those that have been really fighting in a very, very difficult landscape here with legislation, but they didn't have a choice. The momentum of the press forced legislation to do something. And we've been able to have the women come forward and tell their stories and share what is happening to them. And they just haven't been able to catch a breath for the amount of attention that it has brought. It has made it the top national issue in adoption conversation. And that looks really bad for a state like Utah that prides themselves on family building and being the most ethical, responsible state in the nation. So the press has been huge in allowing us to force the hands of people. It definitely put so much pressure on hospitals where doctors were losing their rights for labor and delivery. It definitely called out agencies by name and women. It was showing contracts, it was showing fee schedules. We've had not just the pregnant moms, but adoptive parents coming forward and pursuing legal action against the agencies, breaking contracts with people because of what the press has done. And it is not easy to everyone that has been willing to come forward in the press and share their story. It has been a very difficult process for them. It is not easy to say that you were a part of a trafficking scheme when you're an adoptive parent and bringing a baby home, and the adoptive parents that have come forward and shared all of their contracts, so much behind the scenes stuff that doesn't even get put in the press has been, we wouldn't be able to do what we were doing if we didn't have those people coming forward and sharing their information with us. And people think that we are controlling the press and that we have, but this is just because this story is really what it is. It really is that bad. It really is that crazy. It really is that disgusting. And so people have just, anyone outside of just a little bubble of adoption is going, how in the hell are people getting away with this? And they want to tell the story.
Yeah, I think that's like a regular thing that Ashley and I have asked ourselves over the past few years. It's like, am I crazy? And then like clockwork, something else happens. We're like, nope, this is really happening. I wanted to answer a couple questions in the chat because I'm like, I feel like I'm getting behind. And I also feel like these are really important points to touch on. There's one question that says, what happens if a mom doesn't sign after they give birth? Various things. And Renee sort of answered part of that too and said like CPS is weaponized. CPS is often weaponized. We have seen that too. We've also seen threats that you have to pay the money back, which under Utah law, living expenses are an act of charity. And so you don't have to pay that back unless in circumstances of like legitimate fraud. But that's not what we're seeing. And so we're seeing that the threat of the money, we're also seeing someone's banging on your door within 24 hours and they're like, wow, it's time you have to leave this apartment now. Even if you have little kids in your apartment with you, you have to leave, even if you don't have a plan, even if you've lost your housing at home. We worked with a mom last fall, excuse me. I'm just very pregnant, so I'm things are happening in my body right now. So we worked with a mom last fall who had a documented intellectual disability. She was from Pennsylvania. She was brought to Utah with her partner, and this was someone who was probably going to place her child for adoption, even if she had stayed in Pennsylvania. This was not someone that was going to parent. But she came to Utah because she had been promised $9,000. And the second she stepped off Pennsylvania's soil, she lost her housing. And I don't think that she had the wherewithal to understand the consequences of that as she was being coerced and convinced to come to Utah. And so she didn't change her mind, but when it was time for her to go, you have to go. And so, but what she kept articulating to the agency was, oh, I don't have a place to go back to. Well, their job there is done. They're not helping you resource on the back end. And so they're sending you home and you're going to be homeless. And we've talked to several moms that has been their reality.
Mhm.
And they've been in a worse situation after working with the Utah agency than they were before. And so they went through a formal eviction process with her. They published publicly in public records
Mhm.
her relinquishment paperwork and with the courts. They evicted her and she went home to Pennsylvania with no housing in December.
Mhm.
So this is kind of a standard practice. This is someone who has a disability. And so if you do that to someone who is in that kind of a life circumstance, you'll do it to anybody. I firmly believe that. So um, it's really there's a range of threats. And like Ashley said, they are documenting sensitive information about you during the process, so they can certainly fire back at you with that information and turn it on you if they see fit. Um, yeah. And then um let's see, we've got like 7 minutes till we can, but I guess we're kind of answering questions out. Betsy asked, what do you feel is the chance this legislation will pass? Betsy, ask me every hour for the next 30 days, 60 days. I have no idea. Ashley and I have also come to a place where if the legislation doesn't pass, like we'll be back with legislation next year. And also that there's so much more to come. There's a PBS Retro Report documentary coming out in a matter of a month or two, is what we've been told. So if it doesn't happen, that's not our fault. We just don't shoot the messenger. But there's media ongoing. There's new cases being reported on as we speak. So we're also of the viewpoint that if this doesn't get past this session, that it's not over. I also am not, that doesn't mean that we've like given up on this legislation before, but we also understand that it is a huge uphill battle. And the agencies have hired a really high-powered lobbyist. And so who knows? But we're definitely not going anywhere in the process. We'll just be here ready for whatever. Have we
Yeah, the sessions have been
okay.
they've been very, very charged. This is a very difficult dynamic in Utah, um, with very deep-rooted belief systems and old systems of law reform. They've been very aggressive and intense, and it really at this point, like again, they had to do something because they couldn't ignore the publicity, but we could go any direction. We have a lot of different pokers in the fire, which is really good place to be. And the bill isn't perfect. There's things in there that we love and things that we don't, but I mean, the elephant is so large here that it's like picks a place like to start. Like it's gotten so bad that we just at this point are like, what are the battles now versus the battles later, because they are not the same. They're not. We have different fights that have to come at the different times, and there are things that need to be done and dealt with right now. Money was a huge part of that, and transport was a huge part of it.
Yep. Yeah. So our work is really still very focused on educating birth parents on what their existing rights are under the existing Utah code, and how they can advocate for themselves. We have a lot of resources on our site, and we're actually overhauling the website right now to make it way more just expand the resources to birth parents, including birth fathers, and helping them understand not only what their rights are in their state, but what their rights are or not only what the rights are in Utah, but also comparing that to what their rights are in their own state. And so they can have all the tools at their disposal, and hopefully we can catch them before they make the move, they relocate to Utah. Still working out the details on how to reach them before that point. But yeah.
But we're continuing to deliver flyers
Yeah.
monthly and making sure we're going door to door as we discover new apartment complexes where women are being brought to in isolation, and getting really creative with just all the ways that we can like kind of secretly get to the moms. The agencies are really pissed about us doing flyers. We've been followed. They've put up ring cams. They bribed the birth parents with cash to go follow us and take the flyers down after we put them up. It's been a very interesting process, but we keep delivering where we can, and that's how they're getting to our site and running ads in sandwich shops and places that we know that they're going to be where they might not be watched quite as closely. And so we're hoping to continue to make this for the women and for their partners and for the fathers to be able to understand what we're sharing with them so that they can really advocate for themselves.
So I just put a link to our website and then a link to our email. The website is going to be really changing a lot in the next few weeks. So you'll notice that. But so if you look today and you're like, I'm not impressed with this, be like, just wait, because Kelsey's really working on it. But you can contact us at our email. I know we're also going to be including some links and resources with Ty so that you guys can get kind of the show notes of today. But also I wanted to kind of open it up for questions if we wanted to go that route. Ashley, if you have more to say before then.
I think that's great.
Okay, great.
There's been several questions in the chat, and one that came through private message that asked, with all of us being from other states, what can we do to support this?
I think like if you, first of all, this is becoming such a common story among just birth parents. Like they're talking, even if they didn't end up going this route, even if they didn't end up relinquishing through Utah and going that route, they are almost always coming into contact with these agencies initially. So they're going on Google, and because these ads are so prevalent all over Google, they're encountering them in one way or another. So even if you're in your own state and you're talking to whether you're talking to community resources organizations in your area, or you're conducting adoption education, or you're interfacing with pregnant women at all, or healthcare. These are all really important risks to know about because it is out of state women being targeted. I remember a couple of years ago, we spoke to, for the first time, a social worker at a hospital in a pretty rural area of Utah, up north of Salt Lake. And she told me that on average, she was seeing 3 women a week come in and deliver babies that they were then relinquishing for adoption. And I said, that's unusually high. Usually a rural hospital like that will see maybe 1 or 2, maybe maximum of 5 adoption placements, private placements a year. And she was seeing 3 per week. And I said, how many of those women are from out of state? And she said 100% of them. So these are not Utah moms. These are out of state women that are being contacted. So I think raising the awareness, like sharing the articles and sharing their resources, talking to your healthcare providers and healthcare systems, and anyone else that interfaces with pregnant mothers is going to be really important. Also talking with adoptive parents. I think sometimes we see adoptive parents who I don't know, I would say we see kind of both scenarios play out. We see adoptive parents who certainly know that this is not what they should be doing, and they see the red flags and they look at them and they think, oh my God, don't look at me. I'm just going to keep doing it because I know at the end of this, I'll probably be able to adopt. And then we see adoptive parents who had no idea what they're walking into, maybe didn't do their research, just went into it blind, went into it on the, suggestion of people they knew and trusted. And that they're getting into this and it feels really icky and they don't know how to name it, what it exactly about it is so troubling. Or they know, but they're so far deep into it now financially that they're like, how do I get out of this and not be ruined? So, but talking to adoptive parents is just as impactful, because we've been able to talk to so many adoptive parents who are like, I thank you for talking about this because we've just dodged a huge bullet. And that's what we want as well. We want that effect. And also we've seen parents who are in it, and they are advocating for these birth parents, from anything to, advocating for them with the social worker and setting the record straight for them, or litigation. We're seeing litigation as well. So that's really important. And also for advocacy purposes, you don't have to live in Utah to take an interest in this issue. You can still talk to the Utah legislature. It's super helpful.
Yeah, I wanted to say too, for the adoption professionals, it's been really interesting listening to the narrative as the sessions have been going on for months, as the legislators are getting together and talking about, as other agencies from outside of Utah are seeing the great effects that Utah's practices are having in their own states, and dealing in the aftermath with women that maybe are coming back to them after, that are in desperate need of support because the promises weren't followed through with. The legislators seem to think that other agencies outside of the state of Utah are just mad because business is being taken. Now, is that true with some agencies? Yes. But I know that there are professionals in this nation that are trying to do good work and keep moms within their state, within their own social services, within the resources, within the state law that best protects them. The agencies that can talk to their own legislators on penalty of their own laws, their advertising laws, having those conversations with their representatives, and writing the letters to Utah to say, this is how this is affecting the scope nationally, it's harming the women nationally. When you're there in the aftermath, picking up the pieces of what happened to her while she was here. Utah is not building Utah families. Utah is a temporary spot for out-of-state families to be spread out and built. And so every touch point for these women needs to be hit. And I know that the adoption professionals have felt the effects of what Utah has done to women in their own communities.
And then I want to talk, Betsy asked if these are out-of-state parents too. A lot of times what happens is they're getting connected to these agencies via adoption consultants. So these are unlicensed kind of entities that they work solely with adoptive parents, to cast a wider net is the language that we've heard, and get connected to a wider agency network, with the hopes of faster placement. And so these are families from all over the United States. So these are not children staying in the state of Utah. I think sometimes people automatically are like, this is an outside perspective, and I don't mean to offend anybody, but like they always say like it's the Mormons, it's the LDS church, and they're making it's not. This is one of those scenarios where I can confidently say like, I understand that that's a pressing issue for a lot of people, but that is not what this is. This is a profit-centered motive. And these are not LDS families. These are primarily faith-based, Christianity faith-based families, but it is not for that purpose. The purpose is it's the profit trail in these scenarios. And then state attorneys general, we have so much that we would like to share about that we cannot at this time. And then has it been considered to change the laws to have mothers appear in court? We have not considered judiciary consent. Um, I don't I don't think that would be popular for one. And also I would have to think about that. Um, Renee, are you saying to change you can come off mute, right? Are you saying to require I'm trying
Yeah.
to require them
They
to
have
do
them
it?
all sign a waiver to say, I don't want to know about any court hearings. I don't want to know about anything. I signed it. I didn't know what I was signing. They don't want me in court, right? They don't want these moms in court. They don't want them there. They want them bye-bye,
Oh,
right?
for sure. Yeah, I don't know.
And they move them out so quickly, though. I don't know how they could even.
Well, maybe they wouldn't be able to. Um, I don't know. No, we haven't. My answer is no, we haven't considered it, but we will think about it. Because yeah,
Yeah,
I mean,
Alex.
and
there's
there's
always
only
a
a few
waiver.
states. There's only a
There's
few
always a
states that
waiver.
require judicial consent.
Yeah,
It's very rare. I have
exactly.
that data somewhere, but
Right. But that's
okay,
kind of part of the problem, right? It's like it just makes it
sure,
all that much quicker, all that much easier. And yeah.
yeah. Um, okay, and then am I missing a question?
I don't think so.
I feel like I am, but I don't know anything.
Yeah, I think you did get them all.
Targeted advert. I do want to address Christine's
Yeah.
question about targeted advertising very briefly, but basically when we talk about targeted advertising, we're talking about the paid advertisements. So the sponsored ads are at the top of the page, and they're actually a bit more hidden now because of like, when I say hidden, I mean they're prominent, but they are, whether or not they're paid, you kind of have to look closely to see if they're actually being paid, sponsored, targeted, because of the way they're being structured now in Google's formatting. So that's kind of making it tough too. So you can't just be like, well, don't click on the sponsored ads, because it's hard to tell which ads are the sponsored ones right now, with the new formatting of the results page. So but yeah, agencies, from the ones who are nonprofit, who we can actually see how much money they're allocating towards marketing. One of the agencies is, I would say, two of the agencies that I've been able to see their 990 are spending an upwards of like $300,000 a year on advertising. And that's just that. One of those agencies also has a for-profit arm. So who's to say that that's comprehensive? So, but that's a lot of money. That's a lot of money. And, if you're looking at agencies, moms could live down the street from a small agency in, Jacksonville, Florida, who, if she's going to place for adoption, then she could actually work with someone that is nearby her, and she can stay in her housing and, you know, stay with her supportive community and with her state resources and her Medicaid and all of that, and have a more range of options and more of a decision-making process. But that agency isn't going to show up on her Google results. It's going to be an adoption agency in Utah. So that's and it's 9 o'clock Eastern time. So
I put a
I think
link in
I
the
don't want to take
chat.
anybody's time, but yeah. And
There's
on the we can include a lot on links and
yeah.
stuff we're shuffling out. So
I'll be sending a follow-up email with the recording for tonight's program, as well as links to all of your websites and socials and good work that you're doing, as well as things we've talked about tonight, the sample advertising. So look for all of that in the next couple of days in your inbox. And then I also put in the chat links to how to find out what's happening at Adoption Network Cleveland, when our the next speaker series is, and how to register, as well as a survey. We always appreciate feedback from anyone who attends our programs. Um, and so I just want to say thanks to everyone for coming tonight. And thank you, Ashley and Kelsey, for sharing so much with us tonight and educating us on this important topic. Adoption Network Cleveland's a nonprofit organization serving individuals and families impacted by adoption, kinship, foster care, and DNA discoveries through support, education, and advocacy. We are a membership organization, and we hope that you'll consider joining as a member to help keep our programs going. And to find out more about our organization and our work, visit our website, adoptionnetwork.org. And we hope to see you next week. We have Katie Gagel, who is joining us to talk about an adoptee's perspective on navigating worthiness through dating, marriage, and divorce. It should be a great discussion. Same time, same place next week. Thank you so much.
Thank you so much.